All right, so what does it really mean when folks say you are paid but unprotected? In particular, we're going to talk today about high deductible health plans. In many cases, you have folks that take those plans because they are what's offered for low cost or no cost for an employer. In fact, we have seen the rate of people joining these plans increase for a number of years. We're in double-digit years now, 10 straight years. The latest numbers that we have is actually only for 2021. Other than the fact that we do know it's increased, we can't tell the exact number of the population. But in 2021, 55.7% of Americans in the private sector were enrolled in a high deductible health plan. Now, that does not mean that they actually had access to an HSA account. It just means that plan fell into the realm of what's considered a high deductible health plan. Now, one of the things I think is very interesting over this is how much the increase has gone, because it's been a very big increase over the years, from only 34% of workers in 2012 all the way to, as I mentioned, over 55% in 2021. What hasn't changed, however, and this is where things get dicey, what hasn't changed is the fact that we still have 55% of Americans that have a high deductible health plan that do not have an HSA or an emergency fund account. So they're delaying care. They're literally going out there and they're not contributing to a plan, even though they're signed up for a plan that provides them, in some cases, in fact, in many cases, most of those people signed up for a plan, it actually has the ability to have that HSA, and they're not taking advantage of it. Now, the number one reason for people saying that they don't contribute to one, they simply cannot afford to. So what they've done now is they've put themselves in a situation where any type of health care that they may need, they can't afford to get. So the numbers prove that out. And of course, what's along those lines is kind of what you would imagine. Depending on where your income is whether or not you're actually putting money into your account and whether or not you will delay that care. Because how can you afford it if you have no savings account and if you're not contributing? So folks that have delayed care for at least 12 months or longer, if you're at 50,000, if your income for your family is 50,000, about 65% of folks there say they have delayed care in the last 12 months. And of those folks, 29% say it's been over a year that they've put off that medical care. When you get to the 50 to 75,000, it drops to 61%. But here's what's remarkable. It's still 29% that say they have delayed it for over a year. So you have to get up to that 75,000 plus before it even drops at all there. And so 54% still say they've delayed healthcare in the last 12 months, but now it's dropped down to 19% that put it over a year. And once someone has a family income of 100,000, it's still a pretty remarkable 40% of individuals have delayed medical care for more than 12 months in that, even making that much money. So that shows us that they're delaying this because, and this is just the only reason they delayed it in this particular study, the only reason they delayed it was financial reasons. They're saying we simply could not afford to get the care that we need. Ladies and gentlemen, that is not access to health care. They literally are paid but unprotected. They are paying their premiums whether or not they have one. And what I mean by that is if they signed up at work for the plan that didn't cost them anything, that is still being paid. That's part of their benefits, right? So the employer is now paying that premium. So it is being paid for, but the individuals on that plan are not protected. If you're delaying care, you are not protected. High deductible health plans were really designed to reduce unnecessary health spending. And they're actually getting a boost again, a bipartisan boost, I might add, in the legislature right now. When they reconvene here in September, they're going to be talking about this. They're going to be looking to address things to make these even more, I won't say more affordable, but they're going to look at things that maybe have people go this direction, like the ability to use telemedicine in that plan. That was allowed during COVID. They made an exception for it. That has gone back away, so you can't do that anymore, but they're looking to make that a more permanent feature. So one of the things that is happening here is they're really focusing on that particular part of it, right? They're saying, let's reduce unnecessary spending and let's encourage consumers to actively manage their costs. Wow, that's a great idea. That's a great idea. But when we still have such a horrible problem with transparency and actually getting the prices and knowing what you're going to pay in advance, whenever you call up the doctor's office and they can't tell you how much it's going to be if you're self-paying, or in this case, even if you are paying with your insurance, we can't tell you how much it's going to be until you come in and have whatever done. That is a barrier to healthcare. They're not going to do it. That is why so many people have simply chose not to get it done. So that is it's one of the more interesting things that I think we keep having people push this out there, these ideas out there that high deductible health plans are great, but who they're actually great for is the employers, and they're great for the insurance companies. Now, I'm not saying they don't have a place. What I am saying is they are pushed out in many cases to the wrong folks, because you're not, think about the dynamics and the demographics of the folks that are purchasing these plans. You cannot tell me that they're the right choice for almost 60% of the population. When you look at whether or not folks are actually going to have a plan, was it ever explained to them properly? Do they realize what they're getting into? I think the overwhelming answer is no. Because whenever I talk to individuals that are on these plans, whether it's through a group or whether they purchased it themselves, say on the marketplace, they really don't understand how it works. They don't understand that they've got to spend their first dollar on their health care. And here's the worst part of that. Once they realize that, they don't understand then that they still have access to some benefits. In fact, the primary benefit that they should be getting at that point, and that is their preventative care. Their preventative care is still covered at zero cost, but they don't know that. All they heard was, when I go to the doctor, I've got to pay for it. And so now it's lumped all into their minds that all of that is going to be the way it is. So it's very frustrating to people when they find themselves in a situation where they thought they had insurance, everything was paid for, they're keeping up with their premiums, but now they are what we call functionally uninsured. Being functionally uninsured means that I have insurance, but I might as well not even have it because I can't use it. I don't have any type of savings. I don't have any money on hand to be able to actually go and see a doctor. It really has nothing to do in this case of whether a doctor is in or out of network. Because if you have a plan and you could go to a doctor, you simply cannot afford that visit. Or if you could, you don't know that because you can't get any prices up front. So a couple of things to think about whenever you are offering these type plans or considering these type of plans, whether you're a broker that is looking to help an employer get set up, or whether you're an employer that really wants to offer plans for your employees, is providing the information to help them make good decisions. First of all, who is really a good fit for a high deductible health plan? There's really three parts of this. First of all, someone who's generally in good health, someone who has good health and they're interested in comparison shopping. They're going to look for high quality, low cost medical services. That's going to be who is a good fit for it. Also, those who have an HSA or want to start an HSA and have the funds to do, someone who really understands the benefit of paying for your health benefits or paying for your health services and getting the tax benefit to do. An HSA can be an outstanding source of income later in your life if you don't use it all. It basically can be another IRA when you get into retirement age. And then number one is, or the last one, and I think this is the most important one, is someone who can afford the deductible. If someone has a $3,000, a $4,000, a $5,000, a $6,000 deductible, they need to understand what that is and do they have that money set aside? Because if they can't pay that deductible, guess what? Barrier to healthcare. No way they can get the services done that they need. What if they do understand that it covers preventative service such as colonoscopies and mammograms and things like that? That's great. What happens if they find something? What are they going to do then? Because remember, some of these delays, in fact, a lot of these delays are there because some type of diagnosis was made. But because of the barrier of cost, they simply did not get anything done. So what's the flip side of that? Who are people that should not even consider a high deductible health plan at all? Once again, very easy. Someone who the deductible is too high. If it's too high for your budget and you're not going to contribute to an HSA, bad idea. You're not going to have any money for when things go wrong. And here is one that I think people just don't understand what the costs really are, especially for coming off a more traditional plan onto an HSA. Those who suffer from chronic conditions. If someone has a chronic condition that needs constant care, whether it's medications or multiple visits to the doctor, even something that is commonplace, which is a shame it is, but even something as commonplace as diabetes now, it typically requires multiple visits. Even someone who's not on insulin yet, you're still going to have those follow-up visits where they keep up to date on what's going on with you. If you have those visits, the numbers prove out. People will stop going because all of a sudden that visit is not a $25 or $50 copay. Now it's $120, $150 cash pay. And what people don't understand a lot of times is whatever, let's just say that doctor says, oh yeah, we only charge $70 if you do a cash, that's going to be your office visit. That's right. But now you've paid $70 to see the doctor. That's just the visit. That does not include what happens in that office. And a lot of times there's going to be blood work. There's going to be other things that happen there that are not covered as part of those services. So when you have these things happen, once again, they got me this time. This is the mentality, right? They got me this time, but they ain't going to get me next time. I ain't going back for that. I'll just tell him, just refill it give me my refill on the phone. Why do I have to come in and see you? My numbers are good. I'm keeping up with them. But people aren't. So you've got to understand that these barriers are real. The numbers are not lying. And I'm telling people all the time to be very cautious with your employees and with your individuals that get into these because they can provide extreme barriers to healthcare. People do not have access whenever the deductibles are as high as they are. And I see people that don't even have high deductible health plans, but they may have copays of $100 and they simply won't go to the doctor because of that. So these are the things that we have to think about whenever we're talking to folks, whenever we're talking to employers, when we're talking to employees, when we're talking to individuals, heck, even when we're talking to folks on Medicare in some cases, because of the way some of these plans are set up, you've got to make sure that they truly have access to health care. So I'm going to ask if anyone wants to come up on stage now and give your insight on this. Once again, I don't want to spend all my time rambling along. These are my insights. These are what the numbers tell me. And these are the directions that I point, folks, because I feel like high deductible health plans in so many cases do nothing more than provide barriers to health care. But I'd love to hear someone else's insight on that. Just raise your hand and I'll be happy to bring you up on stage and see what you've got to say about it. I'll give you just a couple of minutes for anyone to do that. Okay, if no one has any insights on that, then I want to bring something else to address this. So how do we address individuals that are on these type plans? A lot of times what we are seeing now and what we are very blessed here in the state of Texas to have is we now have an opportunity for more steering and tiering. And so what that really means is we have the opportunity to build narrower networks of high quality doctors that we can focus our employees that direction. So through different navigation and care navigation, primarily care navigation, if we work with employees to lead them down this pathway, we're able to offer them care at, in most cases, zero cost. Because of the effort that is made here, it's saving money towards the plan or with the plan. And when you save money towards that plan and there's not as much coming out of that claims bucket, it's a beautiful thing for everyone. You can also even make small steps. So let's say that HSAs are still prevalent and in the middle of the year, you're seeing this is a problem. You can also take steps, no matter what time of year it is, by adding in things such as direct primary care or else near and or on-site clinics. But when you do the near on-site clinics, like we have a relationship with Next Level Urgent Care in San Antonio, Austin, and Houston area, those can be added in anytime. And they give folks 7 days a week, 365 days a year. They give them access to in-person and virtual healthcare. So now someone doesn't have to delay that visit because it's going to be zero cost for them to access care at a facility. These are very important benefits, but because it is a separate membership program, it doesn't have an effect on the HSA. It is not part of the health plan. It is a way that you can actually provide benefits to your employees without affecting your actual health plan arrangement. So it's a small step you can take. And remember, anything that goes on there does not come out of your claim bucket. So now it makes a big difference to your plan and obviously potentially to your renewals. So this is the direction a lot of folks are going, whether it's direct primary care or advanced primary care, which is what we're working with next level urgent care, because all of their primary care is through the membership base. They don't actually offer that on the urgent care side. They have two different parts, the advanced urgent care the advanced primary care and the urgent care. We're seeing this more and more. A number of direct primary care offices do the same thing. And especially when they're starting out, they may have some type of hybrid model like this until they switch to 100% membership based. But there are a number of ideas of the way that you can either bolt on things that are part of your existing plan or make wholesale changes. One of the more easier steps is to continue with the type of plan that you have, including using networks, whether that's a PO or an HMO, preferably a PO for this type of organization. And then you put on, once again, the steering and tiering. So everything that goes on that side, because your employees are being led down the pathway of quality care with care navigation, when that happens, those services are typically at zero out of pocket for that employee. It's saving them money, it's saving the plan money overall, and they're getting higher services. One of the recent surveys that I saw talked about how happy folks were with their employer provided health plan. And the highest percentage of people that were happy had plans that included care navigation. About 56% of the individuals that had care navigation said that their plan was, they were extremely happy with their plan. And that was by far the highest level. So it shows that works. Now, here's the irony of that, right? The irony is most people say, I don't want to be told where to go. I want to be able to go see any doctor they want to. But then they turn around and say, well, I don't have any idea what doctor to see. How would I know? So it's that funny catch-22 that I don't want to be told where to go, but I don't know where to go. So actually, I want someone to tell me where to go. So that's where people find themselves. It's a strange situation that you see individuals find themselves in. But this is an interesting situation in my mind because the numbers then, once again, show people really do want help navigating things. They want to be shown a better way. They want to be shown a way that they can actually get care and be led to the doctor that's going to give them the best care. There's no doubt that when they see some of these things out there, that the numbers that are startling and provide them nothing but fear. One of the more recent things that I saw, and when someone sees this, wouldn't it scare you if you saw a factoid out there that medical misdiagnosis affects 12 million Americans annually? Wow. And that 80,000 hospital deaths a year are because of misdiagnosis? That's eye-opening, right? How did they get to those doctors? What happened there? Who made that decision? Part of what care navigation is there to do is to keep those things from happening. Does that mean it never happens? Absolutely. There's no system that's 100%. But it now provides true access to doctors because the individual knows what their cost is going to be. And we also know it's going to be quality care. So it's just a way of moving the cheese, as it were. What do we talk about is that you have to make changes. You have to be innovative in this marketplace because they're putting out higher and higher deductibles. Think about this. If you don't know this, Marketplace plans right now for this year, they can have a deductible of up to $9,100. And then think about how many people are on the marketplace, but the majority of those are receiving a tax credit. The majority of the people, and it's a huge number, 90+% of the people on marketplace receive a tax credit. That means they fall into a situation where this plan is only affordable to them because of their tax credit. But they have a $9,000 deductible. They're functionally uninsured. But we see this across the board. It's not just in ACA plans or marketplace plans. It's also happening more and more in group plans, especially small group plans, because when you look at those small groups, once again, the risk has to be moved around. So the risk is moved to where? Higher deductibles. Higher deductibles mean less access to health care. All right, I've rambled on a few more minutes. Does anyone have any comments they'd like to make now? We certainly have a good number of people here. I recognize a number of you folks that are in our industry. Angela, I know you guys work in that care navigation side. Charles, I know you design plans that look at some of these things as well. Okay, it looks like I called Angela's name, so she had to raise her hand. All right, I'm going to bring you up here on stage, Angela, and get your take on this. Don't forget to unmute yourself.
There we go. I couldn't find the button. I was just thinking when you were talking about the quality care, and certainly more and more often, physicians' offices are being bought up by hospital systems. And so many of the physicians have to, by contract, refer within their system. What if there's not a good cardiologist in that system? So typically what happens, at least in our situation at AIM, is that if there is a DPC included, then when the DPC refers the patient past them, then we ask them to call the nurse. At that point, we can look and see where they're being referred and whether or not that really is the highest quality provider within their geography, within the network. We look at all of those things. So it's a matter of making sure that they're getting that quality care. That's what steerage is all about.
Absolutely. And I think that the misnomer, and you and I have talked about this, and I've talked about this with Nurse Deb, I've talked about this to a lot of people, but you guys are in this world here. And that is, just because a doctor is in a network doesn't mean that they're a good doctor. Just because your doctor's in XYZ insurance company's network doesn't mean anything. It means that they met the minimum requirements of anyone to be in that network and they applied. Right. And that's what's interesting. I know I had a conversation with Nurse Deb about y'all approached one of the big insurance companies. Y'all did all your homework and you said, okay, so here's what we found. We found this group of doctors right here is the bottom 25%. And we would like you to take those doctors out of the rotation. We don't want those even in. We don't even want our folks that have our health plan to have those doctors as an option. And that insurance company come back and said, we can't do that.
Right.
Under our contract, everyone is allowed equal time to be at the top. So it doesn't matter if your last name begins with a B or a Y. The chances are the same that you'll be at the top of the list under your category at any time. And it doesn't matter whether you're a great doctor or a not so great doctor, your chances of being at the top of that list are exactly the same. And that is terrifying because I can tell you as a consumer years ago, before I knew all of these things, I just made this crazy assumption that the insurance company was on my side and they would have checked that out and made sure those were good doctors. I wasn't seeing the guy who graduated last in his class.
That's right. And when we're looking for quality, that's what we're looking for. And the way it works with AIM is that, and of course, obviously we follow the plan, but it doesn't matter whether the quality doc is in network or not. If they're the best out there, then, and the patient has called us and they follow our suggestions, then their copay and deductible are waived. Now, there are some restrictions when it comes to HSAs as far as that goes. And Harlan, you probably know that better than I do. But The point is that we're looking for quality. And of course, the TPA is going to get involved, and there are going to be direct contracts or whatever needs to get done to make sure that we get the best cost as well. But we're looking for that quality provider to make sure that the patients are getting the absolute best quality care. And fortunately, as we all know, that unlike most things in the United States, quality care, quality health care typically means costing less.
Yeah. Yeah. Which, once again, that is a direction a lot of folks don't realize. And I think one of the main things that I have seen pushback on from employees in particular about saying, I don't want to be led somewhere, is they feel like that, right, this is the human mind. If it's not costing me anything, you must be sending me to a low quality, cheap doctor.
Mhm.
And what it really is just the opposite. Because this doctor is higher quality, they're going to treat you better. You're going to get better services and better outcomes. And that's really the key, the outcome. What does the outcome look like? Is this doctor treating your diabetes, or is he working to get you off of insulin and working to get you off of metformin or whatever you're taking? Is he looking to get you to where now whatever you're doing is controlled via a diet and a change in lifestyle? Or is this doctor doing nothing more than you come in and we use the flavor of the month insulin, and all it's doing is just managing your diabetes?
Very
There's a
true.
whole situation there. One of them still could certainly end you up in a bad situation as far as hospitalization, and there's so many bad things that can happen with diabetes. But the other one is looking to put all that behind you. And so that is the difference. That's unfortunately one of the big situations that happen, once again, with high deductible health plans, with folks that get on those that have chronic conditions. Their only reason they're getting on that plan is because it was the lowest cost option, without truly understanding what it's going to mean to their health care. And so putting those plans in place without proper education, that is what makes barriers happen. That's what makes employers in the long run have a whole population that ends up getting worse in health than better in health, even whenever they're offering a health plan. So and I'm telling you guys right now, care navigation is certainly a big part of that. But as Angela mentioned, if you have a true high deductible health plan with an HSA, there's only so much that can be done in those situations. So you have to watch out how you match up these plans. There's just so much that's involved in all of that that you need to make sure that you understand that before you go down that pathway. So, Angela, I certainly appreciate your insights there. All right. Do we
Absolutely.
have anyone else that would like to come up and talk about any of the experiences they've had? Even if you've had an experience with a client or yourself with a high deductible health plan, something you would like to share with a situation that you said, okay, here's what happened with me whenever we had this type of plan and the barriers that I faced. Once again, whether that was you yourself or possibly a client, anything that you have that you'd like to share that may be beneficial for folks to hear, to have better understanding of how to position these plans, I certainly would appreciate that. So give everyone just a minute here to, okay, Kelly's got something to say. Let me bring her up on stage. All right, you are here. Don't forget to unmute yourself and take it away.
So I just thank you for letting me up here. And I just want to say that we have done ACA referral business for a long time. So we're going to stop it. I'm going to step away from group and go into individual. But there is a place for this model with individuals also, because they are finding themselves in these high deductible situations just the same. So when you look at this, the solution that we are going to propose this year is definitely adding in the additional DPC model, right? Wherever that is, we're going to find them and help them find providers. We're going to explain what that looks like, and we're going to give them an opportunity to see that yes, you need this zero cost plan, but your family can achieve better health with this membership, and then there is no more deductible, right? So you're going to be able to see your doctor. You're going to be able to get managed care. You're going to be able to get continued medications, things like that. So I do think it's important for each of us to take a guiding hand with our clients, right? And then sometimes what that looks like when we move and shift to the group side is you're going to have hard conversations with employers to make sure that they fully understand what they have saddled their employees with and what the end result of that is. I feel that, again, and I think I've mentioned this before, that education is primary. So I think that's what's so good about doing these rooms and getting people out there is educating everybody on what the possibilities could be if we try a different approach.
Yeah, absolutely. And you're right. Education is the key, regardless of whichever direction. And I'm going to encourage you, especially if you are putting together health plans or you're an employer out there that's looking, open enrollment's coming up for a lot of folks. Look at some of the options around your area. And if you don't even know where to look at, then give us a shout and I'll be happy to help you look for options as well. But one of the things that we saw was this huge need in our primary focus areas. We work all the way across the country, but our primary focus is here in the Texas area and some of the big metropolitan areas. And that's why we made the partnership with Next Level, because what we were able to do with them now is advanced primary care and urgent care at zero cost to our members. But the price point of that, whether standalone or inside the plan, is only $80 a month for the entire family. So for $80 a month for your entire family, no matter what kind of health plan you may have, you now still have access to health care at zero cost, all your urgent care needs and all your primary care needs. Now, that is a game changer for folks, and it gives them true access to health care. And if they have chronic conditions, that helps them get better. And I'm not just promoting our program. I'm letting you know that these things are possible. Reach out to someone that's in your area. If you're in another part of the country, know that there are folks out there that are willing to partner with you, both DPC doctors and some of these urgent cares that are doing urgent care and advanced primary care. This is a great place to start because, as I mentioned earlier, you can bolt these on at any time, even if they're using a full-blown or fully insured plan, not even a level funded or self-funded plan. You can still put these on to run alongside and actually provide true access to healthcare. It's an easy first step for an employer to do as they start moving away from those fully insured or from one of those big carrier type plans and into something where they can better control their cost. The only way that you're ever going to see an employer truly take control of their healthcare cost is whenever they actually start taking steps to control their healthcare cost. Staying status quo and just paying that renewal every single year and hoping that we have a good year and so it doesn't go up next year is not going to work. You've got to start taking control of those things. And that's the only way that you're ever going to see a difference. The traditional way has been every 3 years we just change to a new carrier and that's how we control our rates. You're still seeing those increases every single time. And you're also seeing increases not just in your rates, but increases now in your deductibles and therefore less accessibility for your employees. So there's a number of solutions out there that you can do. Once again, we'd love to talk to you about that. If you don't even know where to start, give us a shout. We'd love to help guide you in the direction of working with those direct contracts. As Angela mentioned earlier, direct contracts are a beautiful way to start affecting real change in your healthcare. And anyone that tells you that you cannot have a PO network, in other words, you're renting a network per se, and direct contracts, that's just simply not true. You can have those two, you can have them working together. It's just the way a plan is designed to make those things function. But they'll never function well without education. And it's also a little bit of a process. You're clearly not going to see a complete 180-degree turnaround from a business in 1 year, especially if they've been fully insured or they've been well embedded with a big insurance company, making some of these fundamental changes to your plan. That's going to take a few steps. So that is really where we wanted to talk about today. Anyone else have any comments? Because I'd love to hear any other comments anyone has about this particular subject or things that they have done and plans to affect accessibility, to prevent exactly what we talked about, and that is being paid but not protected. That is one of the most frustrating things that someone can have is, and we're not talking about your claim got denied. That's also frustrating too. But we're saying you never even got to submit a claim because the cost was so high, you simply didn't get anything done. All right, if nobody has anything else, then I will go ahead and wrap things up for today, but I sure appreciate y'all being here. Our next event in the series of Why Does Healthcare Suck is going to focus on the prescription drug coverage side of it. Obviously, it's always a big part, can be a huge part of the spend. We're going to talk about some of the things that you can do to affect that and some of the reasons why we are where we are today. We did an interesting little audio room yesterday on the spur of the moment talking about the huge increase that has happened all over the top 25 selling brand name medications. The fact that those medications have gone up in cost an average of 300% since they've been out. With some of them, such as Lantus, that in 23 years has gone up 739% over the cost of when it was first introduced. So we'll talk about those things. And once again, some of the things that you can do as a broker, some of the things you can do as an employer to affect those costs. Sure appreciate everyone being out here today. Don't forget, we do have weekly little catch-ups on industry news, 10:30 a.m. on Mondays and 10:30 a.m. on Fridays. The kickstart and the wrap keep you up to date on what's going on in the industry. Once again, you want to find out more about our company, Eagle Care Health Solutions, you can go out to our LinkedIn page or check us out online at eaglecare.com. Appreciate you folks listening in today. Don't forget to reach out to me personally if you have any questions on how to arrange any of these things. Appreciate it. Y'all have a blessed day.